Welcome on the behalf of the Dempsey Center and the Association of Maine Cancer Support Centers, and in honor of the National Cancer Survivor Day. Thank you for joining me today, Dr. Speckhart. Would you mind introducing yourself?
Sure. Thank you for having me. My name is Ashley Speckhart. I am a physician trained in pediatric oncology, and I currently work at Maine Medical Center. My current focus of care is in field of medicine, which I call survivorship medicine. I have led a survivorship clinic for over 17 years through Maine Medical Center.
Awesome. So tell me a little bit more about your role at Maine Medical Center.
So as I mentioned, I actually run two clinics at Maine Medical Center. One is we call the Pediatric Cancer Survivorship Clinic. This clinic is for any individual who is 17 years of age and younger who've been treated for a cancer at any point in their life. The other clinic is a clinic that we refer to as the AYA, an Adult Cancer Survivorship Clinic. And this is for individuals who are over the age of 18 and who have been treated for cancer at any point in their life at any location. So I see individuals in their 40s and 50s who have been treated for a cancer as a child or young adult, typically. And the majority of my practice it consists of young adults, so individuals between 18 and 40 years of age.
Interesting. So is a focus on adult survivors of childhood cancer and young adult cancer survivors a relatively new specialty?
That's a great question. I don't think it's not necessarily a new specialty. It's something that we've been aware of for, I would say, 40 years, but it's certainly an area of medicine that is evolving, especially in the last 2 decades. So what we're seeing, and it's amazing, we're seeing more and more cancer survivors, and cancer survivors are leading longer lives. And what we're finding from that is that they are at increased risk for kind of unique and chronic conditions due to their diagnosis and treatment at a younger age. And with that recognition, our field is advancing. So we're learning more and more about these chronic conditions and how we might intervene to kind of lessen the impact on their care. And this is a field that will continue to grow and expand as we're intensifying treatment, and especially as we're adding new agents. In the last 5 years, we're seeing a lot of agents that are working with the immune system to prevent and treat cancers. And it will be interesting to see if these agents also lead to long-term side effects that we currently don't anticipate.
So there are definitely like a multitude of challenges that these people are going through right now. And what are some of the unique challenges faced by survivors of both childhood cancer or young adulthood cancer?
So I can speak mainly for childhood and adolescent cancers. For individuals who are treated as a child and adolescent. And what we know from long-term studies is most this age range chronic condition. And we typically refer to this chronic health deficient condition as a late effect. I think it's also very reasonable that these late effects are probably underappreciated or recognized in older individuals who are treated with cancer. So these chronic health conditions, they can affect pretty much any organ system. But the most common late effect that I see is what we call a cancer or related or treatment-related neurocognitive dysfunction. And what that is that individuals can sometimes have difficulty focusing or staying on task after their treatment. And that can be really difficult to diagnose, especially in a child who is going through elementary school and then goes through adolescence and then as an adult. But on the flip side, it can certainly impact their education and how they learn. So that is the number one late effect that I see, and one of the real challenges that cancer survivors face. And what I've seen in my adolescent and young adult patients when I mention these, describe these late effects, they will recognize, yes, they definitely feel like they have this. And for those individuals, sometimes it causes a lot of anxiety because they can feel that, they compare themselves to their peers. They feel that they are just as smart as their peers, but they do have to work harder to accomplish, maybe obtain certain grades or accomplish certain tasks. And so it can create quite a bit of anxiety. Another late effect that probably the most significant or severe late effect that I see is subsequent or secondary cancers. What we know is that individuals treated for cancer at a younger age, primarily if they receive radiation, are at higher risk for second cancer as they get older. And this risk does not plateau, meaning that it continues to increase as these individuals age. And that risk is primarily in individuals who are 20, 30, and 40 years out from treatment. So what that means is that in an adult who is maybe 40 years old, their cancer diagnosis at age 5 can actually be significant for their current health. And so those are, when you ask kind of what are some of the challenges, I think keeping track of these long-term late effects and knowing about these long-term late effects so we can do the appropriately screen and help these individuals to help mitigate them.
So are there different issues related to survivorship for young adults who are diagnosed with cancer? For instance, like impacts on dating, fertility, parenting, college, things like that. What are some of the common concerns or issues that you address in your work?
Yeah, I think that's a great question. Yes. So although the late effects may be the same, how they impact that person really depends on where they are in life. The obvious one is fertility. So, a 6-year-old, their parents may be concerned with long-term fertility. That 6-year-old is not concerned with their fertility and should not be concerned with their fertility. That is quite different from someone who is in adolescence or a young adulthood, and different from someone who's maybe in their 50s, 60s, or 70s, where fertility may not be as much of an issue. Certainly, sexual health is impacted by cancer and cancer treatment. And again, that it really affects people depending on where they are in their lives. And so when we look at late effects and address how to help individuals, we should also keep in mind where they are in their lives. The majority of cancers are diagnosed in individuals over 60 years of age. And so when we look at the literature regarding late effects, we need to keep in mind that that's primarily reflective of people who are older and are not necessarily reflective of the needs of adolescents and young adults. And this is an area that needs future study. We need to gather more information from adolescents and young adults regarding what their needs are following cancer treatment.
If someone's watching and they had some kind of question about when they should start accessing a survivorship clinic, what would be your suggestion in terms of how long after should you wait before you reach out to one of these clinics, and how does it work, along with someone's primary care doctor or oncologist?
So it really depends on the individual. If someone is continuing to see their oncologist, many oncology practices offer survivorship care, and that would be something to discuss with their oncologist. At some point in time, many patients no longer need to follow up with their oncologist. Historically, that might be 5 years from diagnosis, but it can depend on the diagnosis. Certainly for individuals who are diagnosed with breast cancer, follow there with their oncologist for much longer periods of time. But at some point when that individual is no longer following up with their oncologist, it may be reasonable to seek out someone who specializes in survivorship care on a yearly or maybe every 2 to 3 year basis, just to understand, get a better understanding of their unique health needs, because we're gathering more and more information regarding survivorship and the health risks of cancer treatment as people age, and coming to a survivorship is a means of gathering that information. In regards when someone should go to a survivorship, I think it's a clinic, I think it's very individual. Some people want additional information right at the completion of their treatment. Some people don't want that. But I think it is reasonable to follow up with somebody at some point in their life to get the information regarding what is unique to for their health needs.
Yeah, it's incredible the amount of thought that goes into this, because a lot of times, I mean, we see here at the center, people come in and they want to treat their cancer and get it over with, but there's so much that comes afterwards in terms of survivorship and going forward after. So this is really important work that you're doing here. Do you have any other suggestions or things you'd like to mention to anybody watching with questions on survivorship?
I think you're exactly right when you say, many people are diagnosed with cancer, they want to treat it and move on. And I completely agree. My ultimate goal is to have a diagnosis be a chapter in someone's life. I would like for a cancer diagnosis not to define their lives. And that's my ultimate goal. I recognize that that's not realistic for many people. But for individuals who've been treated for cancer and are years following therapy, I do believe that understanding the unique health needs that they may have some long-term benefits. And so I think I am personally a big advocate of education and knowledge and preventive medicine, and hopes that this would be an area that people would seek out.
Incredible. Thank you so much for sharing your knowledge with us today, and for joining me. And I certainly learned a lot. This is extremely important work, and it's not something that everyone thinks about all the time. So it's really great that we have people like you out there doing it. Well, thank you so much for joining me today. I had a wonderful time getting to meet you, and thank you for those who are watching. And I think that concludes today's interview.
Okay, thank you very much for having me.